Hello everyone, my name is Edgar Betancourt and this is my final capstone presentation for NU 476-8A Nursing Capstone with Professor Melissa Knapp, MSN RN for Herzing University. First we're going to identify the problem. This is identification of the problem. The problem is the need for ultrasound technology for phlebotomy. I am a home care nurse. I work for McGregor PACE. It's the program for the all-inclusive care for the elderly located right here in Northeast Ohio. 3 locations servicing over 600 participants. Myself, I'm personally responsible for the care of approximately 50 participants. And the need for updated ultrasound technology is necessary for participants in the program who are in critical need of lab values, and most of them that are in critical need of lab values for whatever reason, they're hard sticks. They're very difficult to obtain blood from, even in the hospitals when they go visit the hospital. So the need for ultrasound technology for phlebotomy is very important. Also, the problem is cost. Where I work, it's not a large institution. It's not a large organization, and the cost seems to be a problem. The ultrasound technology could be in the tens of thousands of dollars, and they don't find a reason to dig deep in their pockets and spend the money to get this equipment at this current moment. So the growing number of patients that are hard sticks is another reason why the ultrasound technology for phlebotomy is necessary. The benefits of ultrasound guided IVs. First, we can see that it's life-saving by providing the needed lab values in a timely manner. The physicians and nurse practitioners can intervene and change medications around. We have people that are on psych medications. We have people that are on medications for kidney failure. We have people that are on medications for anemia. So these lab values, these blood values are very crucial and very critical and need to be obtained in a timely manner. It prevents unnecessary hospital appointments, especially right now with the COVID situation. A lot of participants, a lot of the geriatric population here in Cleveland are very skeptical of going out and going to the hospital to get a blood draw, so they don't see it as important. Also, decreased attempts. Studies have shown that when compared to traditional blind venipuncture techniques, ultrasound-guided peripheral IV access is frequently more successful on the first attempt and requires less time, reduces the number of needle punctures, and improves patient satisfaction, as cited by Wallace and Taylor. No date. We're going to the SWOT analysis now, which is our strengths, weaknesses, opportunities, and threats. Now, McGregor PACE is the only free waiver program in the county, Cuyahoga County. The weaknesses is the lack of funding. Opportunities is a federal small business loan. Now with the COVID pandemic, our organization has qualified for the small business loan. So I've been an advocate of digging into that money and getting much needed equipment, much needed technology. And the threats is the decrease in enrollment numbers. With the threat of COVID, we've had a decrease in enrollments. I mean, we typically average 25 to 30 participants potentially a month. We're down to probably getting about 5 or 6 people per month. Increased fear. In an article by Javadi and Nategi, the authors point out that as the COVID-19 pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear, worry, and concern in the population at large and among certain groups in particular, such as older adults, care providers, and people with underlying health conditions. As I mentioned earlier, our patient population is pretty nervous. They're pretty scared of going out to get these blood draws. So at times we have a situation where they go a month or two without getting a blood drawn because of them being a difficult stick. So that becomes a concern. The increased fear right here amidst the coronavirus crisis, Americans are already suffering and fear the future. Here we have some numbers retrieved from kff.org. You can see that 72% say it disrupted their lives a lot or some. 74% say that it's the worst is yet to come. So people are really looking forward to the upcoming months, the upcoming year now, with the large increase of coronavirus diagnosis. Also, 39% say they've lost a job or income. This has become an issue with people straddling the poverty line. A lot of businesses losing, their businesses. A lot of restaurants have suffered here in Ohio. I mean, restaurants that I've been going to for 15, 20 years, no longer in operation and close their doors forever. 45% has affected their mental health negatively. Suicide rates are up nationwide and around the world. Here in Ohio, we have a epidemic with mental health issues, a lot of homelessness and mental health, and now this has increased it even more with people losing their jobs and the anxiety levels up. Fear that the nation's healthcare system will be overrun, 82%. We're on next to the literature review. The issues with the phlebotomy is addressed by Akil and Mershon when they announced that vascular access can be challenging when patients present with obesity, edema, poorly palpable pulses known as vascular disease, intravenous drug use, and limited access options. Ultrasound guided access is beneficial for venous access since many veins are not palpable and lie close to the major arteries. One problem that we have with our nursing staff is that we have 2 nurses on staff that are very proficient, that are very good in blood draws. Myself being one of them, and a clinic nurse that we have in the Old Brooklyn office here in Cleveland that we're relied heavily upon to draw blood on these hard sticks. Right here you can see an illustration, a cartoon of Batman and Robin with Batman giving Robin a swift one to the cheek, and it says, "I'm a hard stick, you have to use a small," and slap, he gets slapped. Shut up, I'm a phlebotomist, I got this, put your arm out. Continuing with the literature review, ultrasound-guided central venous access is now considered the standard of care, improving both success rates and reducing complications such as arterial puncture. This could be an issue with arterial punctures because of bleeding. Like most purchases, pricing on a vascular ultrasound machine varies widely from model to model. You can find models for under $10,000 or over $100,000. On average, though, you're looking at $20,000 to $40,000. And being a former employee of the Cleveland Clinic, I've seen the $60,000, $80,000, $100,000 models, and yeah, they are pretty pricey, but they are pretty effective. The leadership theory. In proposing this to leadership, we have to take in consideration the different types of leadership required to run an organization like McGregor Pace. Right here we have the comparisons between transformational versus transactional. This transformational approach to leadership relies on encouraging and motivating followers to participate in molding a successful future for an organization. This often includes establishing a group's common purpose, a concept rooted in organization's official vision and mission, which are 2 aspects leaders use to help define and outline goals. As quoted by DeFranza 2020, cited, transactional leadership theory consistently finds ways to create developmental process, White 2018, as compared to transformational leadership theory, which allows others to contribute by allowing them to introduce concepts that collectively serves the organizational needs. So the difference between transformational and transactional is, transformational is more focused on helping the person change, as compared to transactional, which finds ways to change the process or change the way it's done in organization. Here we have Lewin. Kurt Lewin, as stated by many people in the medical and in the psychology field as one of the founding fathers of psychology. Lewin's theory of change, and right here he has a quote, if you want to truly understand something, try to change it. With Lewin, I chose Lewin's change theory of change, I'm a fan of this. I've been writing about Lewis's theory of change here for the past couple of years in school, and I'm particularly fond of the stages of Lewin's theory of change. The unfreezing, unfreezing is where you introduce it to the masses and get them ready for what's about to happen. So at this point in the unfreezing, you might get some people that are not on board with it, but you slowly present it to them and you unfreeze it. Then the change comes. The change comes, and this is where you present the uh, the uh, the proposed deal, the proposed change for the organization. This is where you might get some of the resistance. Change is what drives the transformational leader, and then this nursing theory can be the driving force to implement an improvement in the required organizational needs, such as updating the equipment. We need to update our blood draw equipment, our venipuncture, ultrasound technology that we need to purchase. So that's where the change comes. The refreezing is after everyone has accepted the change. You refreeze it to basically make it permanent. At this point, when you refreeze it, it becomes permanent. People have to accept it. Now, the only drawback with the refreezing is that everybody has to be on board with this. If everybody's not on board with this, it could become a problem. So you have to make sure that everybody's on board with the freezing stage, because it's establishing a change as a new habit. So that becomes a standard operating procedure. Without this, people can do it like they used to do it, like the old way. I'm just going to do it my way, so they can go back to um, observing old habits. So in presenting the ultrasound technology, we got to get people to accept it. We got to get people to accept it. We got to, bring about the change. And then once, we can potentially get the organization to introduce it and purchase it, we can refreeze. The evaluation of the proposed change is compare hospitals and their costs on an annual basis. So the hospital stays, we document every time that we send somebody out to the hospital to get this procedure done. It's a waste of resources. We have to send transportation out there, man hours, and then also another evaluation of proposed change is to train all the nursing staff on the proper use of the technology. Get everybody proficient on it, so we're not just having particular nurses going out and performing these blood draws. Also, patient satisfaction. What better way to know if you're doing a good job than to have your patients, praise the services that you're providing for them, and also save on resources and manpower. As stated before, sending transportation to go pick them up, sending them to appointments. These cost money, and in the long run, I believe that the cost will offset with the number of participants requiring these blood draws and these appointments that are being scheduled and all the man hours being used to transport them to the appointment. The conclusion: the purchase of the ultrasound for venous access is necessary for the continuum of care. What better way to provide the best possible services than to be updated with the best possible equipment? Technological changes in the nursing industry has evolved, so we need to be on board with staying updated with the equipment. Also, we'll save the organization money and man hours. Initially, it's going to be a huge investment, but eventually, it's gonna offset the cost, and we'll save money for years to come. Also, we'll increase patient satisfaction. Patients will be satisfied because there will be less sticks. If you miss once, you're not going to miss 2-3 times with the ultrasound technology. So patient satisfaction is a big one. And also, it's going to provide clinicians with timely specimens for immediate intervention. My name is Edgar Betancourt. Once again, this is my presentation for the final capstone. I hope you enjoy it. Have a good day.